Hi, and today I'm talking about toothpastes. There's a couple of misconceptions that I would like to clear up about toothpaste. The first misconception is that toothpaste actually clean the teeth. Well, in fact, they don't really. The soft deposits that you find around the teeth called plaque is cleaned off with the toothbrush or little interdental brushes, and the harder deposit that you find around the teeth, which is more like a limescale consistency, it's called tartar, and that can only be removed by professional cleaning by the dental hygienist or the dentist. The second misconception is that toothpaste actually stop gum disease. Well, it's the removal of the soft deposits and the hard deposits, so the plaque and the tartar, which actually stop the gum disease, because that's the actual products where the bacteria is held in and that's held onto the tooth. So by removing those deposits, by cleaning the teeth properly, that's what in fact gets rid of the gum disease. And the last misconception is that toothpaste whiten the teeth. Well, in fact, they're not really on the teeth long enough to have an effect, and if they are, they're quite abrasive, and so therefore they are damaging the enamel. So when choosing a toothpaste, what actually does it do? The first thing is, obviously, it makes it taste a lot nicer for when we're brushing and cleaning around our teeth, because you've got that minty taste and that foaming action, which, you know, just generally makes the mouth feel fresher. And the second thing that the toothpaste does is, in fact, it provides fluoride, and the fluoride in the toothpaste is actually what hardens the enamel and makes it more resistant to the bacteria, so it actually reduces your risk of decay. So choosing a toothpaste with a good fluoride content in it is always a good option. There is a lot of controversy with fluoride, but personally I feel that it's the only form of fluoride that we're actually getting, so it's not so much around in the water anymore, and that it is better for the teeth. So I will address fluoride again in another video, but for the moment I would always choose a toothpaste with fluoride in it. A couple of tips when you're using toothpaste. First of all, to rinse around after brushing. No. When you've brushed your teeth, what you want to do is to spit out and not rinse, because if you rinse, you're rinsing all the chemical agents of the toothpaste off the teeth, so you're rinsing all that fluoride off the tooth. So you really want to keep it on the tooth there once you've brushed. So to spit out and don't rinse. The second thing is, when you're using the toothpaste as well, that you want to use a small, sort of like a pea size amount on the toothbrush, so that you're not having too much around there. Like I said, it's a mechanical removal really. So that's for adults over, or children over the age of 7, and anyone under the age of 7, then obviously you're going to use more of a child's toothpaste, and you're going to use just a slither of the toothpaste on the brush there. If you find that you have some areas which are more sensitive than others around the mouth as well, what you can do is, after brushing, is pop a little bit on your finger and just rub it into that area, so there's a concentrated amount on the actual area that you need it, and the fluoride will help to work in there. Hope that's helpful. Any problems? And you can contact me on my website, which is www.bristoldentalhygienist.com, or you can go to my Facebook profile, which is Bristol Dental Hygienist. Look forward to speaking to you again. Bye now.